Now students, in today's lecture, we're going to study toxicology of anticholinesterase agents. So basically, we're going to study organophosphate poisoning in this lecture. Previously, we have discussed that after aging, ecothiophores form a permanent bond with the enzyme acetylcholinesterase. Permanent bond this is a bond in which there is not possible to break the bond between the drug and the enzyme. So, we are going to study toxicology of anticholinesterase agents. So, irreversible acetylcholinesterase inhibitors that are organophosphates are commonly used as agriculture insecticides. They have use in a homicidal purpose for murder. They can be used for suicidal purpose. They can cause accidental poisoning as well. So this is very important to study this drug, to study the treatment of this poisoning. So organophosphates also includes nerve gases such as sarin, which is used in the wars. It is used for chemical terrorism because this is an agent which can cause cholinergic crisis that can affect your body badly, that can cause enhanced or exaggerated effect of the acetylcholine. Now, we have reactivators of acetylcholine as well. The most important reactivator of reactivator of the enzyme acetylcholinesterases include pyrrolidoxine, that is 2-PAM. So 2-PAM can reactive the inhibited acetylcholinesterase, but before aging process. So, however, this drug is unable to penetrate into the CNS, so it is not useful in treating the CNS related effects. So, in organophosphate poisoning, or one of the major side effects of organophosphates is that they have ability to enter the CNS and cause convulsions. But in that case, you can't use pyrrolidoxine. You can't use this drug, you can't use 2-PAM to reactive the drug acetylcholinesterase to again cause the degradation of acetylcholine, because in that case pyrrolidoxine is not possible. It is not possible for the drug to cross the blood-brain barrier to enter into CNS. So pyrrolidoxine, that is 2-PAM, that is pyridine, P for pyridine, A for L-doxine, and M for methiodide. So pyrrolidoxine is the first example of enzyme reactivator. It is the example of the enzyme that has ability to reactive the enzyme acetylcholinesterase before aging. So the second example is the obidoxine. Now, basically, this 2-PAM contains a charged group, that is a positive group. This approaches towards the negative charge anionic site of the enzyme. Then before aging, this 2-PAM will try to displace the phosphate group of the organophosphate and will try to regenerate the enzyme. This will try to regenerate the enzyme acetylcholinesterase. So this drug will try to increase the level of acetylcholine. So, if given before aging, this drug has ability to reverse both muscarinic and the nicotinic peripheral effects of the organophosphates. But as I have already discussed, this is not for the CNS effects. Now, I have a question that why 2-PAM cannot reverse the effect of OP in CNS? Because 2-PAM cannot penetrate the CNS, 2-PAM cannot cross the blood-brain barrier. Now, when we discuss about the nerve agents, these nerve agents produce aging within seconds. They produce aging of the enzyme complex. They produce aging of the enzyme with the drug, with the organophosphate within seconds. So, pyrrolidoxine is less effective because this is not good drug after aging. Pyrrolidoxine is a weak acetylcholinesterase inhibitor, and at higher doses, this drug can cause side effects which are similar to other acetylcholinesterase inhibitors. So, in addition, this drug cannot overcome toxicity of reversible acetylcholinesterase inhibitors, for example, physostigmine. Now, if a patient is suffering from overdose of organophosphate, if he is suffering from organophosphate poisoning, In that case, one can use atropine to prevent the muscarinic side effects. So such effects include increased bronchial and stridulations, bronchoconstriction, and bradycardia. Secondly, one can use diazepam to reduce the convulsions. So other options are maintenance of patient airway, oxygen supply, and artificial respiration. Now, what is organophosphate poisoning? The features of organophosphate poisoning include salivation, lacrimation, urination, defecation, meiosis, dyspnea, bradycardia, muscle fasciculation, that is twitching, convulsions, and respiratory muscle paralysis. So, what is the treatment for organophosphate poisoning? As I have already discussed, different options, but again I am summarizing. The treatment option, first one is decontamination, second one is to give sedative, third one is to give antidote. So coming towards decontamination. If your skin has been exposed to that particular agent, to organophosphate, the first priority is to firstly try to reduce the dermal exposure. Okay, if there is exposure, wash your hands, wash that particular surface with detergent that contains the sodium bicarbonate. Then you can undergo gastric lavage. For the CNS, you can use sedatives, that is diazepam for the convulsions. We have antidotes like atropine sulfate, which will antagonizes the effects due to acetylcholine. Then we have enzyme reactivated, that is pyrrolidoxin, but this enzyme reactivated is active or is effective only before the aging process. So this was all about the toxicology of organophosphates, signs and symptoms of OP or organophosphate poisoning, and treatment of or management of the organophosphate poisoning.